Hello, I'm Dr. Tom Groover. I'm sitting in the reception of Koru, that's Koru Chiropractic in Louisville, Colorado, with the director here, Dr. Norris Golberg. And I became interested in Dr. Goldberg. I'm an old-time chiropractor. He's a new chiropractor. And because he is a subluxation-based corrective chiropractic care specialist, and that's a very unique thing. And I just wanted to talk to him a little bit about this and share some of the insights from him that I've gleaned over the time that I've known him. And hopefully this will turn into a series of conversations, because Dr. Goldberg goes very deep, and I've had lots of interest in things like chiropractic philosophy, corrective care, subluxation-based chiropractic most of my life. So Dr. Goldberg, thanks for hosting us here.
Yeah, thanks for joining me and kind of coordinate this interview. I think we'll get a lot out of it, and hopefully our viewers get a lot out of it. It's a great way for us to dive deep on a few subjects, and we're going to try to keep them brief so they're digestible, and then just bring out multiple episodes and series of them.
Great. Well, I'm looking forward to that. And what I would say is that for starting out, let's just get a little bit more familiar with the concepts that we'll be covering. When you're speaking of chiropractic, that fits a large class of diverse things, and there are certain schools of thought within the chiropractic profession. I want to clear things up a little bit. So what would you say a subluxation is, first of all, chiropractic subluxation?
Right, so a subluxation, in the definition of the chiropractic that we do, is a bone that's out of place that is causing a neurological deficit and causing physiological changes because of that. As we know, the nervous system and the brain coordinates and controls every other organ system of the body. And what we have found, and chiropractors have known this for about 125 plus years at this point, but now the research and the technology advancements that we've had even just in the last 5 years is showing us what the real science is and what is actually happening when we make adjustments to the spine. So it's not as simple as just moving a joint or a bone. It's specifically one that's actually causing a neurological deficit. And we use a lot of testing in the office, both during examination processes and even just table side, to evaluate how the nervous system is functioning before and after an adjustment.
Yeah, so now that's great. So then the idea of corrective care, that's something that I've been involved in all my life. I'd like to hear from you, from your perspective, what you mean by corrective care.
Absolutely. So as you know, and many of our viewers know, there's over 200 different types of chiropractic care. So the swath of what you can do in chiropractic is pretty broad. Everything from physical therapy to nutrition to just popping bones and what we call the flying seven, right? Cracking them from head to toe, anything you can move, just hitting the high spots. But corrective care is a branch of chiropractic that is focused more specifically on structural changes in the spine and functional changes that allow the body to actually not just get a temporary change, but really a long-term change, and really providing our clients and our patients with a long-term solution to their health goals.
So what you're saying is that there's a directed purpose in this, and toward identifying an abnormality and then actually correcting the abnormality, not just managing it.
Absolutely. So we, for example, look at things like curve loss in the cervical spine. Really common thing that we find these days, especially with what we call tech neck or text neck, plus people who have had traumas or accidents. Once you've lost the curve of your spine, we know there's going to be a neurological deficit. So our job as corrective chiropractors is to really work to restore the curve, right? We can also find these changes with things like lower body abnormalities, lower cross syndrome, pelvic misalignments, sacral misalignments. And so again, not just finding it, but fixing it, and then strengthening and stabilizing that patient to a point where they're either self-sufficient and they can go back to the way they want to live their life, or what actually I find is a lot of patients really find the value in upkeeping or maintenance care. I actually call it protective care in the practice, because the reality is stress, gravity, trauma, it never leaves our life, right? We're always being subjected to that. And so we really find that patients who undergo regular chiropractic care, and it doesn't have to be super frequent, just some sort of consistency, just like you consistently brush or floss your teeth, you eat healthy, you drink water, you exercise, these consistently healthy things in our life actually add up over time and provide a long-term benefit versus, some people like to prefer to do this. They'll come in just for emergencies. They'll come in when they just hurt. we can help them a lot, but it's not always the best solution in terms of the long-term outcome of their health.
Yeah, it's a very different approach from what I've seen historically in a lot of the different chiropractic that I've seen in school, that I had given to me when I was younger, where it was almost like the goal of the chiropractic was to adjust, and so the promotion for the office oftentimes was come in and get an adjustment and you'll feel a lot better.
Right.
And what's really interesting observing you and your work is that there are times when a patient comes in and you don't adjust at all. In fact, you've talked to me about the wisdom of knowing when and when not to do a procedure on the spine.
Yeah, that's probably the thing that makes me the most different than a lot of other chiropractors. Again, when you show up, I call it an office visit and a checkup and an adjustment if needed, right? Sometimes we call it a correction, because we're doing corrective care. If your nervous system is functioning properly, and this is why we use technology to actually measure this, if your nervous system is functioning properly, you don't need an adjustment that day, right? And we can tell because when people come in, they are dysfunctional. There's all kinds of abnormalities that are happening, and then with specific and gentle adjustments to the spine, we can see these things start to work better and better. Of course, they're really happy when their symptoms and their pain alleviates. I'm really happy when I see the spine looking healthier, moving healthier, and the nervous system functioning better. And the difference being that when you're operating well, when your body's working well, why go in and mess with it? Why mess something up? That's honestly, just like an adjustment can fix someone, an adjustment can hurt someone or cause a subluxation. So at the right place, at the right time is extremely important and a big differentiating factor in what I focus on versus other chiropractors.
Yeah, so what I would say, folks, if you're interested in corrective chiropractic care that's subluxation based, I think that from my experience, this is where you want to come. It's in Louisville, Colorado. It's very convenient to Boulder and to Denver. And what we see is that when chiropractors like Dr. Goldberg here get rolling, they'll have patients coming from all over the country and even some people visiting from outside the country as well. So thank you very much for hosting us, and we're looking forward to our next post. I think what we'll do is go more deeply into the subluxation and describe what we mean by neurological deficit and how it's measured. What would you say? Yeah,
absolutely. I'm excited to do more interviews, more conversations. I think we could talk for days on any topic. So we're trying to keep it brief so that you guys can get the most out of it in a short period of time. But also make sure you like and subscribe below so you can see the new videos that are coming out. And also comment if you want us to talk about something particular in chiropractic care, something maybe something you've heard about chiropractic care, you want some answers addressed. We'd love to do those as well.